Hello everyone. Today I'm sharing an important topic that every diabetic needs to understand. Have you heard the saying, you can tell diabetes just by looking at the feet? This isn't just a myth, it's a medically backed signal that can show how well your diabetes is managed, or if dangerous complications are starting. Diabetes, with its high blood sugar, affects the body in many ways, and the feet often show distinctive signs. Recognizing changes from the toes to the soles early can help prevent serious complications. First, an important note. This video is for educational purposes only. If you notice any unusual symptoms in your feet, consult a healthcare professional immediately. Regular foot checkups are essential for diabetics. So why do diabetic feet need special care? Prolonged high blood sugar damages? Blood vessels and nerves? The feet, being farthest from the heart, already have poorer blood circulation, making them vulnerable. High blood sugar clogs or narrows small blood vessels, reducing oxygen and nutrients to the feet. Nerve damage also dulls sensation. Together, these create a risky situation. In fact, diabetics are 10-20 times more likely to face foot amputation than the general population. But studies show proper care can prevent over 85% of these amputations. That's why today's info is so vital. Let's start with early warning signs you can spot in your feet. First is a change in toe sensation, numbness, or a tingling feeling. Many describe it as feeling like they're wearing socks. Second is burning in the soles, especially at night, making it hard to sleep. This is called diabetic neuropathy, a common diabetes complication. Third is changes between the toes. Frequent cracking or fungal infections occur because high blood sugar weakens immunity, making you prone to germs and fungi. Fourth is nail changes. Nails may thicken, discolor, or develop fungal infections with inflammation around them. Fifth is a color change in the feet, toes turning bluish or pale signals. Poor oxygen supply due to circulation issues. If lifting your feet makes them paler and lowering them turns them abnormally, red suspect peripheral artery disease. Sixth is temperature changes. Feet may feel cold or unusually warm, sometimes with a difference between the 2 feet. Seventh is delayed wound healing. Small cuts on the feet don't heal well, growing larger or deeper due to poor circulation and immunity. Eighth is a change in foot shape. Toes may curl or arches may deform, a condition called Charcot, joint or diabetic arthropathy. Ninth is calluses. Persistent calluses in specific areas can lead to ulcers underneath, as dulled sensation prevents feeling pressure. 10th is a change in foot odor. A stronger or unusual smell could indicate bacterial infection or ulcers. If you notice any of these, consider checking for diabetes, especially if you have a family history or are obese. Now, let's explore the major foot complications diabetes can cause. First is diabetic neuropathy. High blood sugar damages nerves, starting at the toes and spreading to the ankles and legs. Neuropathy has 2 main symptoms: dulled sensation or hypersensitivity. With dulled sensation, you might not feel cuts or burns. With hypersensitivity, light touch can cause severe pain or burning. Second is diabetic vascular disease. High blood sugar thickens and stiffens blood vessel walls. Small vessels in the feet clog or narrow, reducing blood flow, known as peripheral artery disease. Symptoms include cold feet, leg pain while walking, and weak ankle pulses. In severe cases, pain occurs even at rest. Third is diabetic foot ulcers. With dulled sensation and poor circulation, small wounds don't heal, growing into ulcers. Deep ulcers can infect bones. Common sites are the toe tips, calloused sole areas between toes, and heels, often where shoes cause pressure or friction. Fourth is infection. High blood sugar weakens white blood cell function, increasing infection risk. A small cut can lead to bacterial infection, even progressing to sepsis in severe cases. Signs include redness, swelling, pus, fever, or a foul. Odor: seek medical help immediately if these appear. Fifth is Charcot joint. Nerve damage prevents pain perception, allowing unnoticed strain on bones and joints, leading to collapse, sudden swelling, or deformity. Requires urgent care as pressure concentrates, risking ulcers. Here's what diabetics must do to manage their feet. First, check your feet daily. Use a mirror to inspect soles for cuts, blisters, calluses, color changes, or swelling. Don't skip between the toes, look for fungal infections or cracking. If hard to see, get family help or use a hand mirror. Second, wash feet properly. Clean daily with lukewarm water below 37°C. Hot water risks burns, especially with dulled sensation. Use a thermometer or have someone check. Wash between toes thoroughly and dry completely with a soft towel. Moisture there can cause fungal growth. Third, moisturize. Apply lotion after washing, but not between toes. Excess moisture invites fungi. Focus on heels to prevent cracking. Fourth, care for nails. Cut straight across to avoid ingrown nails. Don't cut too short file-sharp edges. If nails are thick or hard, see a podiatrist or foot care specialist to avoid injury. Fifth, choose the right shoes. Allow 1.5 centimeters of toe space. Avoid tight or loose fits. Ensure toes move freely. Check inside shoes before wearing for stones, debris, or torn lining, as dulled sensation hides these hazards. Buy new shoes in the afternoon when feet are slightly swollen for a better fit. Break them in gradually, starting with short periods. Sixth, manage socks. Change daily. Cotton or wool absorbs moisture and lets feet breathe. Avoid nylon. Turn socks inside out or choose seamless ones to prevent pressure from seams. Seventh, do foot exercises. Flex and extend toes, rotate ankles, or lift and lower heels to boost circulation. Try picking up a towel with your toes while seated to strengthen muscles. Aim for 10-15 minutes daily. Eighth, quit smoking. Cigarettes constrict blood vessels, worsening circulation and multiplying foot complication risks for diabetics. Stop now. Ninth, control blood sugar. The root solution is keeping HbA1c below 7% while managing blood pressure and cholesterol. 10th, get regular foot checkups. Diabetics should have at least one annual exam. High-risk cases need more frequent visits. Doctors assess sensation, circulation, and deformities. Now, things to avoid. First, don't go barefoot even indoors. Wear slippers to avoid stepping on objects. Second, be cautious with foot massages. Dulled sensation can hide excessive pressure. Avoid intense sports massages. And inform professionals about your diabetes for safe, gentle circulation-boosting sessions. Third, don't soak feet in hot water. Avoid hot baths or hot springs. Check temperatures first, or have someone assist to prevent burns. Fourth, don't remove calluses carelessly. Razors or callus removers risk cuts. Leave it to a podiatrist. Fifth, avoid applying creams between toes. Antifungal or other ointments can trap moisture. Worsening issues, use only as directed by a doctor. On emergencies, seek immediate care for these. Signs: wounds with pus, suddenly cold or discolored feet, severe pain or total numbness, foul odors, or severe swelling. These signal serious complications, and delays could lead to amputation. Even on weekends or nights, go to the ER. Here are special products for diabetic foot care. First, diabetes-specific socks, seamless, moisture-wicking with wide toe areas. Second, pressure-distributing insoles to prevent ulcers by evening out. Sole pressure custom options available. Third, foot temperature monitors to detect inflammation or infection early. A 2C difference between feet warrants attention. Fourth, foot inspection mirrors with handles and adjustable angles for easy sole checks. Family can help too. First, check the patient's feet daily. They might miss something. Second, inspect shoe interiors for debris or damage before wearing. Third, join in foot exercises. Togetherness boosts consistency. Fourth, prepare for emergencies. Know warning signs and keep emergency contacts ready. Seasonal tips: in summer, high humidity risks fungal infections. Wash and dry feet thoroughly. Choose sandals with toe protection. In winter, feet get cold and dry. Moisturize well and wear warm socks, but avoid electric blankets or heaters due to burn risks. Spring and fall are great for buying new shoes. Check fit and replace ill-fitting pairs. Foods aiding foot care include garlic, ginger, cinnamon, nuts, and fatty fish for Circulation, though blood sugar control remains key. To recap diabetic foot care, check and clean feet daily, wear proper shoes and socks, exercise regularly, quit smoking, control blood sugar, get checkups and prepare for emergencies. Foot care is a lifelong task, but with proper management, serious complications are preventable. Small daily efforts yield big results. Your feet support your body, don't let diabetes stop you. Proactive care keeps them healthy. Start today by checking your feet with a mirror. If anything seems off, see a doctor without delay. Early detection and treatment are critical. I hope this video supports the foot health of those managing diabetes. I'll return with more helpful info next time. Stay healthy!